interacting with patients, solving problems for them, helping them with medications, whatever it may be, rather than sitting in a computer trying to document.
Hello, I'm Zach with the American Journal of Healthcare Strategy, and you are listening to the Clinicians and Leadership podcast series, where we focus on empowering clinicians from bedside to boardroom. I'm joined today by Dr. Mark Pratt. Dr. Pratt, why don't you take a second to introduce yourself, tell us a little bit about your experience, and how you got to where you are today?
Sure. So, hey, I'm Mark Pratt. I'm an emergency physician by background and training. I did emergency medicine for about 18 years. But then, kind of at the start of that journey, also, I was very interested in informatics and the clinical application into technology. And so, actually, ended up getting board certified in clinical informatics as well. And have this is my 20th year working with hundreds of different facilities that have implemented physician order entry and documentation software and other technologies that relate to healthcare. So it's been quite a fun journey for sure.
And Dr. Pratt, I think that combination of your experience within the medical informatics field and your experience as a clinician serving in emergency medicine offers some unique perspectives that I'm excited to dive into today. I think just as we get started, we'll start with just kind of this question, and it's coming off of a term that is thrown out quite a bit and experienced by a lot of different physicians and clinicians and individuals in the medical field as a whole, and it's this term of burnout. And there's been a lot of focus over it in the last couple of years, and a lot of interest in ways that we can negate or reduce this burnout that clinicians and medical staff members are facing. How do you perceive the relationship between technology and burnout? Are we addressing root causes when we try to implement new technology, or are we simply just treating these symptoms of burnout?
Yeah, I think that's been really interesting to watch. And so, I've gotten to watch how these systems have been implemented for a long time now, and I think it's really pretty simple to watch what happened. And as more and more requirements came along for what was initially called meaningful use and now promoting interoperability, the EHR companies just simply added more widgets or steps or places to document, and it just became more and more additive. And so I think the answer is really simple: is that we've introduced way too many things that kind of interfere with that natural clinician workflow and how they want to interact with technology and their patients. And so I think if that's the ultimate root cause of our issues, is that we've introduced systems that make practicing medicine and interacting with colleagues and patients very awkward for the clinician.
Mm.
And so I think if we focus on bringing it back to what makes their day work best for them, it'll be a very simple solution, which I'll talk some more about.
Yeah, yeah. I'm interested to hear your thoughts on this next question. A little bit of a follow up to that previous question we just had. And it's a broad question that a lot of people have put a lot of attention to, but I'm interested to hear your thoughts specifically for because of your experience in both of these fields. But what systemic changes do you think would be helpful to make this field of health IT a tool for empowerment rather than frustration? You've mentioned just we keep adding and adding and adding, and that's taking clinicians away and forcing them to learn almost a completely different language and something that they didn't fully go to school for. And as technology continues to go forward and evolve, it's continuing to add. So I'm curious to hear what systemic changes would be helpful for empowering your clinicians rather than frustration.
And I think that was the initial intent of what meaningful use and promoting interoperability was really designed to do. And if you think about it from a clinician perspective, the clinician is really wanting to get data, do something with the data, and at the end of the day, they're really just documenting and placing orders for a patient. Those are really the three things. And so if you can make those three things as smooth as possible, you're really going to address those issues of frustration. And so I think it's the more clinicians I talk to that interact with multiple systems, it's really about getting access to data because what's more, there couldn't be anything more frustrating than trying to get a chart from a particular facility about what happened with the patient at another healthcare system that may or may not be on the same electronic health record. And so it's very difficult to get that complete picture of a patient. And so we really talk about making that process easy. We have an application called DB Motion that really goes out and looks for that information for the clinician without having them to go manually ask for the information. And so, I think that whole problem of interoperability, I think everyone understands it. Everyone knows it's a problem, but we're still not to the place where we're anywhere near where it needs to be. EHRs talking to EHRs should be a simple concept. And so we've made standard fields that everyone agrees upon for the most part, but it's still very difficult to get that complete picture of the patient, especially when it crosses healthcare institutions or EHR technologies. And so, if we can continue to work on that problem, we'll be in a lot better place. Um, and so, I think the access to information is probably the biggest place we need to focus.
Well, and I think one of the most impactful things about your answer is that is from not only your personal experience but also in your conversations you're having with colleagues and other clinicians and physicians, and hearing their frustration um, with this some of the systems and practices that we have in place. And so going off of that a little bit, I'm interested to hear your thoughts on the risks of overlooking clinician input during the selection implementation of these healthcare systems, these IT systems. And so what are the risks of overlooking your clinicians, and how can leaders ensure that the voices of your clinicians and your physicians, the people that are going to be using this technology on a regular daily basis, how can leaders ensure that their voices are heard?
Yeah, and I think, and it's the same. That answer is the same today as it was when I started this 20 years ago. And I would tell people the exact same thing we used to tell people is that clinician input during the process of implementing any technology is a critical piece of making it successful because the last thing you want to do is, complete this project that was run by we'll say the IT staff and the folks that aren't in the process of actually delivering patient care, trying to make it fit. And so, if you don't bring the clinician to the table during the process of creating order sets, creating documentation templates, creating any technology that they're going to be using day to day, and then all of a sudden just expect them to naturally adopt it at the end, it's going to be a fail. And so we've seen it happen over and over again, and you can the same holds true for any technology company. you know you can implement those systems, that same system, in a way that's a complete fail or a complete success depending on how engaged the clinicians were during the process of building the system. And so it's really about how you implement the system and engage those clinicians and get their input. And it's been the same. You'll have that same answer, today with any system that you're trying to implement.
Mm,
I think one of the other key things is when you're dealing with clinicians is to follow back up with them. So if if they've given input into a change that they think is going to improve workflow or the clinician experiences, make sure you've come back, and once that build has been changed or updated, make sure that they understand it, show it to them, demonstrate how you've improved it, and they'll really start. You'll start gaining more trust from the clinicians in the process that way. But the more they can be engaged, the better the outcome will be. And the same holds true actually for administrative and executive buy-in. That we always thought that that was one of the most key principles. Also, is it needs to be an organizational change and something that's expected. Um, and so the more administrative and executive buy-in you have in the process is also I think one of the critical pieces of making sure it's a successful rollout in an organization as well.
Well, and I think you put it really well, and just in promoting buy-in, and just asking your clinicians on what would be most helpful for them, and then implementing it, and then asking them again. And that is
Yeah.
a simple concept that can go a long way and do a lot of good, and promote buy-in from your clinical staff, and in turn also help buy-in with your executive staff, like you just mentioned. And
Yeah.
I think that's a fantastic answer, and a simple solution to a problem that can seem more complex than we make it.
Yes, absolutely, and it's a living system. I mean, the order sets that you've built on day one when you go live are not shouldn't be the same ones that you're using 2 years from now. So it's a process that needs to be dynamic and based upon clinician feedback and constant improvement. It's never going to be the same system that you had on the first day of use.
Right.
And if it is, you're not maintaining it the way it needs to be to promote success in your clinicians.
Right. Well, and the medical field as a whole is just such an ever-changing, ever-evolving field, and if you're not actively trying to stay on top of it, you're falling behind, and that extends to the implementation of these IT systems as well. Shifting gears a little bit, Dr. Pratt, a common critique of technology is in healthcare is this. It's accused of interfering with the human connection. The patient provider relationship. Um, and in some cases that may be true, in other cases it may not be. How can clinicians, and specifically your clinician and your physician leaders, champion tools that enhance rather than hinder this provider patient relationship?
Yeah, and if you think about it from the standpoint of a patient, they're going to see their provider because they want to have a conversation with their provider about an issue they're having. And if the provider is focused on some piece of technology or typing something in an electronic health record or trying to get information while that conversation is going on, it's very distracting. And if you've seen one of your own providers doing that, it's very frustrating. And so the more I think we can offload some of those tasks and routines to technology, like go retrieve records for me while I'm talking to my patient, or record this conversation and use ambient listening to transcribe my note at the end of this conversation so I don't have to spend time doing it. The more of those activities we can offload to technology, it just puts that time back with the patient and the physician, which is ultimately what people want from a healthcare experience, is someone to just listen to what's going on with them and help them solve a problem. And so, one of the things we're working on across all of our EHRs is the ambient listening technology. And if you've never seen that in action, it's kind of mind boggling. And a recording device will listen to the conversation between the patient and the clinician, and then produce a note at the end of that conversation with literally no human input. And that takes I've seen it cut down literally hours out of clinicians' days that they would have normally had to be documenting, and now they can focus that time on taking care of patients and doing the fun part of healthcare, which is interacting with patients, solving problems for them, helping them with medications, whatever it may be, rather than sitting in a computer trying to document. And so I think focusing on offloading those activities to technology is going to be one of the really fun things we'll get to watch over the next few years.
Well, and just the you mentioned it just as offloading. I love that term, and how you can enhance that provider patient relationship, building trust with those patients, because simply you're allowing your providers to have a little bit more time with them and to be more focused on that patient. And really, the healthcare is a business, especially in this country, but it's a business of patients, and it's a business of patient care. And anything that encourages better patient care, promotes more a better provider patient relationship, is only going to help that provider and that patient and the system as a whole in the long run. And this next question is coming off of that last point you had a little bit. I'm interested in a world. I mean, we experience a lot of there's a lot of demand of, hey, see more patients. There's an overwhelming need of patients to be seen by providers. And so there needs to be there needs to be efficiency in the process. How can your leaders, your clinician leaders, your physician leaders, balance the demands of operational efficiency while maintaining the priority of the well-being of staff and patients? Because that's a common complaint I hear, and a lot of providers have, is that they have to keep going. They need to be efficient. They can't take an extra second with your patient. So how can leaders help promote this balance?
Yeah, and I think these concepts are closely tied together because the more of those administrative, I'll call them administrative burdens, like what are you having to document? What for some regulation or requirement? What are you having to manage? What are you having to go find? If you can offload those administrative burdens to pieces of technology, you're going to open up more bandwidth. And so this makes the people that, want to generate more revenue happy. And at the end of the day, physicians are, that's how they're making their livelihood as well, is seeing more patients. And so the more bandwidth you open up by eliminating those administrative tasks, the better. And so you've got more time that you can speak with your patient. You've got more time to, spend time at home with your family. Nurses get less frustrated if they have access to a system that's more intuitive. And so, at the end of the day, if the technology piece is not adding to your frustrations, you've got a lot more mental bandwidth to work with the things that are more fun about healthcare. And so, the pieces of ambient listening, generating documentation, the piece about if you can go find information about patients and not spend time on the phone trying to locate a record or calling another hospital's medical record department to get a fax from them. All of those things just add up, and at the end of the day, you've spent hours upon hours doing administrative things that are just not the fun part of being able to take care of patients efficiently.
Well, and you've shared a couple different tools, um, just throughout our conversation thus far, but just it feels as if in here we are in 2025 on the precipice of a just mass implementation of technology that can really take away those administrative burdens and really do a lot of good for reducing burnout, encouraging your provider patient relationship. I'm curious, as like I said, it seems to be we're on the precipice. Some of it has already happened. Some of it's becoming more and more implemented as it's coming on, and it's progressing and it's more widespread. What are some guiding principles that you would set, or you think other clinician leaders could set, to ensure that technology that is being implemented supports both your clinicians and your patients?
Yeah, and that's really just about, if you listen to both of them, when I was in medical school, I mean, we all of our mentors would always tell us, the patient, if you listen to what they say, they're going to tell you the diagnosis. They're going to the story that they're communicating to you is going to tell you the problem. And it's the same thing about technology. So if you listen to the physicians that are using the technology, they're going to tell you what they need and they're going to tell you how they need it. And if you listen to the patient, they're going to tell you what they need and the information that they need access to. And it's pretty simple. I mean, if you follow those guiding principles, one of the other guiding principles I talk to our development teams about is just put yourself in the shoe of the patient, and how would you want us taking care of you or your family member? How would you want this software to be developed so that you're not interfering with a clinician in these ways, to get out of their way and let them take care of you or your family member? And how would you want to interact with the patient portal as a patient? And if you can think of it in those in that mindset, you'll always make the right decision, because if you're making the right decision for ultimately the patient who's seeking care, it's going to be the right one. The same holds true across how we implement technology systems. Um, so I think it's pretty simple.
Well, Dr. Pratt, we are really grateful that you are joining us today on the Clinicians and Leadership podcast. We're grateful for your work and in the ways that you are championing, tough word there, the just the provider patient relationship and implementing technology and these IT systems that are only going to encourage a better provider patient relationship. We're excited at what the future holds, just for the continued marriage between technology and medicine, and we're grateful for all that you're doing and the way that you do it. So thank you for joining us today, and we hope you have a great rest.
Thanks, Zach.